5 years old male to rule out any KUB pathology. These are the iliac vessels, left iliac vessels, and here we see the right iliac vessel. This is the urinary bladder. This black portion is the urinary bladder in transverse section. And this area, echogenic solid area that you are seeing when I move the probe caudally is the prostate. Very rarely you come across such an enlarged prostate with tiny calcifications as well as a few cystic areas within it. Now this is the transverse section of the prostate, and this is the longitudinal section. I have rotated the probe 90 degrees. The transverse section, and you see that there are tiny calcifications. This is a calcification. And when I rotate the probe 90 degrees, this is the prostate in transverse section. Again, you do see some cystic areas within it, as well as calcified areas, tiny calcifications. Now, if we measure the prostate, this is the urinary bladder, this black area. This is the urinary bladder, again is better raised. This is the prostate in longitudinal section. This is the prostate in transverse section. This is the longitudinal section. This is the transverse section. And by measure the prostate via ultrasound machine, the dimension of the prostate comes to approximately 250 grams. Normal is up to 40, and in this patient the size of the gland in grams is approximately 250 grams. It measures 8.0 centimeters in length, 7.1 centimeter in width, and 83 centimeters in depth. So this is a significantly enlarged prostate, which you rarely come across, with small, tiny cystic areas. This one, this area, and as well as tiny calcifications in its substance. Now, the post-maturation residual volume is within normal, is not raised, as this is a post-maturation bladder. And the urinary volume is than 49 millimeter, 49 ml. Up to 50 is normal. So the post-maturation residual volume is normal. This is the right kidney, and the right kidney is normal by all parameters. This is the measurement, 10.1 into 3.4 centimeter. This is the right kidney of Amelia, and we do see normal parenchyma, intact corticomedullary differentiation, normal central sinus hypocomponent. So this kidney is normal. Now this is the left kidney. This name. Here we are. Now it measures 9.8 centimeters in length, 4.1 centimeter in anterior posterior diameter, and there is a small cyst here. This cyst, the cystic area that you are seeing, relates to this kidney. And it moves with the kidney over the source muscle. Here it is at the upper pole of the here it is at the upper pole of the right kidney, left kidney. And it moves with the kidney over the source muscle. This is the source muscle. This is the part of the kidney to get the cyst. This is the cyst. And you can see it moves with the kidney and over the source muscle. Now there is another cyst at the anterior upper pole, anterior region, lower pole, and it is a cortical cyst. This is what a cortical cyst is. This is a cortical cyst measuring approximately 11.6 millimeters, and it moves with the kidney. So these are cortical cysts that are seen very often and are of no significance as a simple cyst, as they are internally clear. This cyst is internally clear, no echoes, no septa, no calcification, nothing. So these are two cysts seen in this particular patient. So these are intact. Now you see, this is in fact the urethral portion. This is the urethra, and this echogenic area is calves, in fact, because here it gives comatose artifact. So PSA is mandatory in this patient. PSA कराया? एक टेस्ट होता है PSA. कराया? किसने नहीं किया? वो जरूर करो. Now you can see that the outer surface of the prostate is intact, the periprostatic fat line is intact. Here we are. Intact, we have intact periprostatic fat line. So PSA is mandatory to rule out any aggressive pathology relating to the analyzed prostate, because there are multiple hypoechoic areas, 1, 2, 3, 4, 5. So there are multiple hypoechoic areas along with multiple tiny echogenic areas within this inhomogeneous appearing prostate in longitudinal section. So far there is no periprostatic, the post-maturation residual volume is within normal, and there is no evidence of urinary bladder outlet obstruction because of significantly enlarged prostate. Thank you.